While taking history from patient in exam, you may face presenting complaint of vomiting of blood, so always be ready and adopt this sequence. In start, ask to the patient, along with this complaint of vomit of blood. Does blood coming from any other site of body? As this may happen in ITP or coagulation defects. Next question. From how long time you have this complaint of vomiting of blood? Ask, how many episodes till this time? Ask about quantity of blood each time. Ask how many spoons or cups. Next questions is very important and need to focus. Ask about color of blood vomit. In our region like India and Pakistan, patient may confuse you while giving history. Actually patient have hemoptysis, but he may say, I have vomiting of blood, instead of hemoptysis. So here in this situation, by getting more information, that is bright red color of blood along with cough, you can differentiate between hemoptysis and hematemesis. Also, it is important to ask about blood clots. Next important question at this stage, is to inquire about black loose stools, which favors upper gastrointestinal bleed. Now in associated factors, ask about abdominal pain, weight loss, bruises, ankle edema, abdominal swelling. Next ask about previous history of jaundice. Till this stage you can decide hematemesis is due to cirrhosis or due to some other reason. If your case is going towards cirrhosis, then rapidly ask questions, to find out cause of cirrhosis, like viral infection, Wilson's disease, hemochromatosis and others. But do not forget to ask following questions, when you have presenting complaint of hematemesis. Ask questions to rule out acid peptic disease. Do you have indigestion and heartburn? Next, ask about use of painkillers and steroids. Ask about other medication, like aspirin or warfarin, as they may cause bleeding. Ask about abdominal pain, weight loss, anorexia or lumps in body. Next question to rule out Mallory-Weiss tear. Ask about violent episodes of vomiting before development of vomiting of blood. In systemic review ask about fever, weight loss, anorexia, lumps in body. Remember, if you have already asked these questions before, then do not repeat in systemic review, as time is short, and it gives bad impression. In medication history ask about the current or previous medications. Ask about previous blood transfusion. Ask about previous admission in hospital. In personal history, ask about smoking and alcohol use. We hope this video will help you, while preparing for exams. Subscribe our channel for next coming videos. Thanks.